This is Avnish Tripathi, first-year cardiology fellow from University of Louisville. Today I have the honor of being with Dr. Beller, and we will ask him a few questions for our FIT video series. Dr. Beller, thank you so much for letting us do this.
My pleasure.
And the time that you've given us. Sir, as we were talking just before the interview, that you are still mentoring fellows, and you've mentored so many fellows in the past as well, and you've been editor for known journals and things like that. Sir, my first question will be from what is your suggestion as far as the mentoring relationship is concerned, how important it is in the field of cardiology, and how we should foster it as young fellows?
No, I think it's extremely important. During my experience, I noticed that when a faculty member, particularly someone engaged in either basic research or clinical research, really took the time to review with a fellow the design and planning of either clinical research or basic research protocols.
Right.
Spend time reviewing data, not just for 15 minutes, but spending quality time to point out strengths and pitfalls of data being accumulated or experimental design, that it was tremendously, I think, beneficial to the fellows. But it doesn't stop there. It goes all the way through analyzing data, writing the first draft of a manuscript,
Right.
which many fellows have had no experience.
Yeah.
So I think sitting down and going through the steps that it takes to finish a project. That's
Right.
the big problem that I saw, is a lot of fellows get engaged in research,
And then
but they're very busy clinically.
Right.
And they have a lot of rotations. They don't get a lot of time off.
Right.
So the study is done, maybe an abstract is done,
Right.
there's a presentation at a meeting,
Right.
but the final step is writing that paper and submitting it to a journal.
Right.
And often fellows leave a program not having finished writing the manuscript of something they spend a lot of time on.
That's right.
So I think it's important for the mentor
Right.
to really make sure that there's time, even if it's on a Saturday, or meeting the fellow during an evening after they're finished their clinic. It's important that those final steps get done, and that won't be done unless the mentor, the senior researcher, really takes the time to complete the work.
Thank you so much, sir. Sir, this leads to a very pertinent question for me and for all of my colleagues as well as fellows. Time is really, of essence. We want to be good at clinical side as well. We want to do research as well. Any tips, sir, for us of how to manage time with all your experience?
Yeah, I think it's very hard to engage in very meaningful research
Right.
if you have no protected time.
Right.
So even during a 3-year fellowship, if you just have a certain number of months
Electives, yeah.
of free time, elective month,
Yes, sir.
where you don't have anything but maybe a clinic, a continuity clinic, but you're not on an inpatient service or a consult service or in the cath lab, you have to discipline yourself that's when you're going to really accumulate the data, review charts.
Right.
If it's retrospective, get into the database. But I think that trying to get any meaningful academic pursuits completed while you're on many rotations can be very hard.
Right, right. And sir, another question is, a lot of fellows, we know that a lot of people will go into private practice, so to say, or non-academic positions, or maybe semi-academic positions, and others will be academic positions. But there is always this argument that, well, I will most likely be private, so I don't need any research. Do you agree with that?
No, not at all. I think if you tackle become an expert in an area,
Right.
and tackle a single problem, whether it's at the session that just got completed here,
Right.
on causes of rehospitalization by 30 days after heart failure.
Right.
And if you really go into something in depth, that stays with you in practice.
Right.
You'll remember that.
Right.
Plus, you learn how to analyze clinical trials that are presented at meetings, how to interpret the literature.
That's right.
You know about the scientific method, about what are valid endpoints in a study, how to power if a study is adequately powered, or
just understanding the research and
yeah,
being ability,
and so
no matter where you are.
Plus, it's a scholar. I think many of our former fellows
Yes, sir.
who are in private practice still are engaged in clinical trials.
Yeah.
They're in consortium trials and outcome studies,
Right.
multi-center trials of new drugs or devices.
Right.
And that is a nice way to balance all of what you're doing clinically.
Right.
It's exciting and stimulating.